go. And I'll do it one more time. Good morning, everybody. See, that sounds right, because this is an exciting day for Kentucky. Through this new and growing partnership with Kroger Health, we will be able to vaccinate more Kentuckians as we receive more supply from the federal government. We are here inside the Kentucky Horse Park's All-Tech Arena in Lexington, where Kroger Health is launching the first regional vaccination site in the state. We have been fighting this war, and that's what we are at. We are at war. We've lost over 400,000 Americans as we sit here today, more than World War I or even World War II. And we've been fighting this war for the last 11 months. But I think when we look back on this battle years from now, today will be one of the days that marks a real turning point in when we began to win this war against COVID-19. We remain at a deadly time where levels of cases are too high, our positivity rate is still too high, and we see far, far too many deaths. But the trends, they are moving in the right direction. Last week, we had our third straight week of overall decreases in new cases for just the second time since we started battling this pandemic. And currently, we are vaccinating people faster than the federal government can get us doses. Those are good signs. But we must remember that the battle is going to continue until we can get everybody vaccinated, and until then, we got to protect one another. Make sure everybody gets through this. So let's continue to mask up. Let's continue to engage in social distancing. And when it's your turn and your time, let's roll up our sleeves and get this shot of hope. Today, we are opening Kroger Health in Kentucky's first regional vaccination site, which means for every Kentuckian, your time is coming sooner rather than later. Across the Commonwealth, we are seeing efficiency pick up every single week. We are getting better and better at vaccinating people. The last 4 weeks, we've vaccinated more people than we've received doses from the federal government, meaning our only limitation at this point is supply, supply, and supply. But we can't simply sit back. We have to continue to grow our capacity, so when we have those additional vaccines, when the manufacturing picks up, when we have a flood of these life-saving shots of hope, that we are ready to get them out there and get them in people's arms as quickly as humanly possible. To date, we've vaccinated more than 362,000 Kentuckians since our first shipment of vaccine just about a month and a half ago. Right now, vaccine appointments are limited due to supplies. Kentuckians in Phase 1B, especially people 70 or older, are currently being focused on and are eligible for vaccines. We're asking all vaccine sites to prioritize this population, where we've got, roughly 300 or 350,000 Kentuckians to go until further notice. Other people from Phases 1A and 1B still remain eligible and will be vaccinated across the state, including at this site today. As vaccine quantities grow, as we receive more, 1C will be opened up, which will include about 1.3 million additional Kentuckians. But remember, we have two goals: to try to go by our priority groups, but also to get 90% of every dose we get in someone's arm in 7 days. That means we are going to have sites that dip into 1C to make sure we meet that goal, because that gets us to herd immunity as quickly as possible. We've also launched a new state website, vaccine.ky.gov, and a hotline, 855-598-2246, or for the deaf and hard of hearing, and only for that community, a separate line, 855-326-4654. These resources are going to help let people know when they're eligible, where they go, and how to sign up. But let's be clear. There still isn't enough supply. So just because you know where to go and you know how to sign up doesn't mean you'll be able to get an appointment immediately. But we ask for your patience, which is hard in the midst of a pandemic, but we will get to you. Everybody in this room that's going to be signing people up and vaccinating people want to vaccinate everybody right now. But quantities don't allow that yet. So remember, stay safe, wear that mask, we will get to you. Here at the Horse Park, we're beginning with in-person vaccinations indoors at the arena, but we're going to be looking to expand to drive-through as the weather warms up and supplies increase. Last week, we announced 4 regional sites that are operating starting today. This Thursday and next Thursday, we'll be announcing additional regional operations just like this across the state. We are told that perhaps at the end of this quarter, certainly moving into the summer and whenever the Johnson & Johnson, AstraZeneca, and other vaccines come online, that we will have more supply. And if you look at this operation here today, you know that we can scale up and provide more. We'll also be able to provide second doses, which requires a basic doubling of what has to be done at any given site. These regional sites ensure that we have the infrastructure in place, both to get people vaccinated and for the customer service. If you need an example of that, when Ephraim McDowell announced that they would be a regional site next week, they received 170,000 calls for their first 300 appointments. So it takes the type of infrastructure that Kroger and other can bring to the table to make sure we can meet the demands. The regional sites will also ensure that vaccines are being distributed widely and equitably with an open enrollment and transparent process. It'll still take time for everybody who wants the vaccine to have their shot at hope, but today is a big step forward in how we can show people, actually show them, that we're going to get this out as quickly as possible. Until then, be vigilant, make sure you follow the rules and the guidelines, and let's make sure, whether it's through some misguided legislation or others, that we don't surrender when we're about to win the war. Once again, I want to thank Kroger and Kroger Health for setting this regional site up and for their continued partnership. And if I can just brag on them a little, the last partnership in COVID we had with them was setting up regional testing locations. That program went so well it became the national model, with the United States government surge testing based on what the Commonwealth of Kentucky and Kroger were able to do together. I believe what we're doing here today is going to replicate that. And before the end of this pandemic, we'll see this right here all over the United States as well. I also want to thank all of our volunteers and workers who are here today. You are now the warriors on the very front line of this pandemic that are going to help us win. To our National Guard, you've been incredible during this pandemic. You've met your calling. You've risen to protect your Commonwealth and your country, and we owe you a debt of gratitude. And to everybody else, in whatever way that you've been working to help out, whether it's showing somebody compassion when they've lost someone, whether it's bringing somebody food when they're in isolation or quarantine. This pandemic tests how good we can be as people at a time when maybe that seemed more challenging nationwide than ever. But I know who we are in Kentucky, and I know we can, we will, and we are rising to that challenge. So now let me turn it over to Lexington Mayor Linda Gordon.
Good morning, everyone. Well, here we are at a place that is home to so many champions to talk about another winner, our Regional Vaccination Center here at the Kentucky Horse Park. It's going to be wonderful, and we're so happy it's here. Thank you, Governor Beshear. Thank you, Secretary Gray, for all your hard work and planning and big thinking. I've heard from many of our citizens who are eager to get this vaccine when it's their turn, and this regional center will provide wonderful access. We want our children to get back in school. We want to open up our economy and be able to see our family and our friends again. We know that COVID has been a marathon, not a sprint. Our citizens are going the distance. Now we're ready to get this vaccine and to put COVID behind us. Currently, there is the focus on vaccinating those in 1B, especially those over 70 years old, at all of our vaccination sites. These are the individuals at higher risk of having serious health complications when contracting COVID-19. Our city is also working with the health department to provide vaccine access to those seniors who have problems with mobility, transportation, and technology. My vaccine task force is working with our local health department, the state, and community leaders to get the word out and get as many people vaccinated as possible. We're all working together. It is a partnership with a common goal. We're saying goodbye to COVID-19. So today, we celebrate this huge leap forward. Thank you again, Governor Beshear.
Next, we have our partner, which is represented today by Ann Reed, Louisville Division President of Kroger.
Good morning. Thank you, Mayor Gordon, and thank you, Governor Beshear, Secretary Gray, and everyone that's come out today. What an amazing day, and I couldn't be more proud to be a partner with the Commonwealth State of Kentucky. So we are here today to make sure that we can begin the vaccination process, and that has been a Herculean effort. And I really want to thank Philly Roberts and Megan Brown and all of our healthcare professionals that are here today that made this all possible. They have moved swiftly with the partnership with our state to really set this up very, very quickly. Kroger's health vision is to help people live healthier lives, and it has never been more important than ever as we expand our testing and our vaccination across the Commonwealth. This work, like all that we do at Kroger, is really about living our purpose, which is to feed the human spirit. Today is just a beginning. We will continue to support Kentucky through phased approach, through these mass clinics, drive-through clinics, and then at some point, hopefully vaccinations in our stores. Our teams are taking all necessary precautions to make sure our residents of Kentucky are safe and that they feel comfortable coming here to be vaccinated. The horse park here allows for us to really be safe and socially distant so that we can maintain proper social distancing and make sure those feel comfortable coming here. This week, our site runs today through Saturday, 10 a.m. to 4 p.m., and next week, Thursday through Saturday, 10 a.m. to 4 p.m. Kentuckians eligible for the vaccine need to visit Kroger.com/COVID vaccine or call 1-866-211-5320 to schedule appointment times for their vaccination. Once more vaccines become available, our efforts will consist of a combination of mass vaccine events and appointments at little clinics and our pharmacies across the state of Kentucky. Kroger stands behind this vaccine. We strongly encourage all customers and associates to receive the vaccine, and we want to make sure folks live great and healthy lives. We are so proud of the work our teams are doing here today and every day to keep our citizens of Kentucky safe. I want to thank the governor and the entire team here today for all their efforts to really make this event possible. With that, I'd like to turn it over to Secretary Gray. Thank you.
Well, thank you, Ann. And, Governor, you said it really, really well earlier. Even in these trying and difficult and challenging times, here in Kentucky, we can crowd the winner's circle. And that's exactly what's being done here today at this site. Really, what amounts to a remarkable effort in just over 2 weeks to stand up this site. And I'm going to come to thanking folks in just a minute, but let me start out by saying that we are very optimistic. Yes, it is, in a sense, it is exciting, even in these difficult times, to open Kentucky's first regional vaccination site today. It's a significant early step in the overall plan to get COVID-19 vaccines into the arms of upwards of 2.5 million Kentuckians. Just about 7 weeks ago, the Pfizer and Moderna vaccines were authorized for emergency use. Since then, as the governor said, 362,000 Kentuckians have been vaccinated. As of yesterday, we have used 86% of the first doses allocated to us. Now, of course, if we had more vaccine, Governor said it well, 3 words: supply, supply, supply. If we had more vaccine, we could vaccinate Kentuckians in higher numbers. We have the know-how, we have the can-do attitude and spirit, and we have the capacity. The Horse Park and Kroger are really excellent examples of that know-how, that can-do attitude and capacity. And so are the local health departments and hospital sites across the Commonwealth who have been vaccinating Kentuckians now for weeks. Our focus in the site selections have been these: population densities, health equity, the throughput, the amount, the volume of folks that we can get through the sites so that we get earlier to herd immunity, and then drive times. Our goal is to have no one have to drive more than 1 county away to get a vaccine. Now, I've said, and the governor said it repeatedly, that getting so many people vaccinated in such a short window represents perhaps the largest logistics challenge in world history. This challenge ultimately will involve additional sites like the Horse Park, which the governor said will be announced in coming days and weeks. These are high-capacity regional locations, but meeting the challenge also will continue to involve the local community settings, including the local health departments and hospitals, who will reach specific and largely those most vulnerable in our population. But still, demand will greatly outpace supply for weeks and months to come. Just one example. As of yesterday, we launched last Thursday the new Find a Vaccine website. And as of yesterday morning, more than 114,000 citizens had gone through the online survey to determine the phase that they'd be eligible to get a vaccine in. Nearly 34,000 of these were in phases 1A and 1B, another 73,000 in 1C. The Horse Park appointments for the first 3 days of this week were filled in about 90 minutes. So, a bit of advice for those who are currently 70 or older: please keep trying. Please keep trying. Have patience. And if you don't get the appointment today, then please keep trying. And remember that we're still in a very early stage of this. So patience. Your turn will come. When the supply increases, we are ready. When the supply increases, we are ready. Now I'm going to wrap up by saying that partnerships are critical as we ramp up the vaccine distribution plan to meet this demand. I want to add my thanks to what the governor has already said, what Ann has already said, the mayor said. I want to thank Kroger, Philly Roberts, Megan Brown, their team, the Kentucky Horse Park, and the Vaccination Distribution Task Force members who are helping make this all possible today. Special thanks to the Kentucky Emergency Management. You're going to hear from Director Mike Dossett. Couldn't do this without him and his team. Kentucky Department of Public Health, Dr. Stack and his team. High performance individuals. Transportation Cabinet, the Cabinet for Health and Family Services, and so many more. So this morning, when the first 600 Kentuckians begin walking through the doors of this arena, they will be breathing, in a sense, a sigh of relief, yes. They've been waiting for this, and they'll be getting, as the governor said, that shot of hope for the future. Thank you all very much. And I get to turn it over to Director Dawson. No, the Lieutenant Governor's next. Director Dawson. Okay. All right, sir.
Thank you, Governor, and good morning. Today I'd like to take a moment to talk about the process, how we got here today, and the teams behind the story in bringing literally a shot of hope to our citizens across the Commonwealth. First, we offer our appreciation for our host, the Kentucky Horse Park, and the hospitality and assistance in preparing for today's opening. The success of our regional vaccine sites, such as the Horse Park and others soon to come, are based on partnerships fostered by Team Kentucky. Kentucky Emergency Management serves as the lead for the Vaccine Administration Site Logistics Group. The Logistics Group is integrated into Governor Beshear's vaccine distribution project led by Secretary Gray, who we just heard from. The Logistics Group meets daily to develop planning initiatives and strategies for regional vaccine sites, with the goal of administering the vaccine as quickly as possible to the largest number of citizens across the Commonwealth. The group is tasked with the review of regional site proposals, research of site capabilities to ensure efficient and effective process, survey team visits, we were here early on, and recommendations to the vaccine project. Subsequently, logistics and operational support for the distribution sites. The group previously had oversight, as you heard, for similar deliverables during the 2020 statewide mobile drive-through testing program, partnering with Kroger Health to conduct over 70,000 tests, literally putting the Commonwealth on the map, and developing the Kroger national template for drive-through test sites across the country. We appreciate the partnership and support from a long list of local, state, federal, and private sector agencies that made today possible. Each state-sponsored regional vaccination distribution site typically consists of a team of over 50 personnel with a variety of supporting agencies, many of them represented here this morning. Partners in the group include Kentucky Emergency Management, the Kentucky State Police, the Kentucky Department of Public Health Immunization Branch and Preparedness Branch, the Kentucky Department of Facilities and Support Services, the Kentucky Transportation Cabinet, the Kentucky Department of Parks, the Kentucky National Guard, thank you, and the Kentucky Board of Emergency Medical Services. Our FEMA Corps from DC has teams in the state EOC providing personnel for call center support to our vaccine hotline. Our FEMA Region 4 administrator is providing technical support for our federal vaccine distribution award. And thank you to our Kroger Healthcare vaccine team for their clinicians, site teams, leadership, and their exemplary corporate volunteerism in giving back to your community, in the protection of the lives of those that live and work in our Commonwealth. Thank you, Governor Beshear, for developing and fostering the environment for public-private partnerships with companies like Kroger and our healthcare systems. And last but most importantly, we highlight our first-line partner agencies, including our local health departments, hospitals, our healthcare facilities, city and county leadership, members of law enforcement, and all of our emergency services. Thank you.
And now, for the reason that we are all here today, I get the honor to introduce you to the very first gentleman who is going to receive the vaccination here at the Horse Park Regional Site. Mr. Paul French is a 74-year-old veteran from Lincoln County, Kentucky. And Paul, I played some, yeah. Paul, I played some basketball in your neck of the woods at one point in my life. And just like so many other Kentuckians, he has some underlying medical issues himself. He's a diabetic, and he has a pacemaker. And, maybe the best part here, he is one treatment away from finishing his chemo treatment. So, Mr. French, I want you to know you're the reason that we all are in here today wearing masks, and that we should be wearing masks across Kentucky as this vaccine rollout continues. I can tell you this, as excited as you may be, I know that your family is going to be just as grateful, because this means that they are going to get to spend some more time with you. And so I'm so happy to be with you today, and without further ado, I will turn it over so that Mr. Paul French can receive his shot of hope. I think if anybody deserves it, it's him. So thank you.
Thank you to Paul. Thank you for your service. We are really excited about this. I bet kids and grandkids and the rest are too. We'll take a few questions if you got them, and then we'll get everybody out of here. So new sites will be announced on Thursday, and our plan is for registration to go live at 5 p.m. that Thursday for those, just like they did this last week. We are still working through some of the technology. I think it took just a little bit longer this last week, but I think we have it worked out. So it should be 5 p.m. for those sites on Thursday. Yes? So when we look at the different priority groups, 1A was a very defined group that had tens of thousands of people. I think it was a little under 100,000, but maybe if you expand it, you know, dentists and the rest, which fall into it, maybe you're in six figures. 1B is significantly more, but then 1C is 1.2 or 1.3 million. While 1B is challenging because of the amount of vaccine that we're getting in, 1C is going to be another, I believe, greater logistical challenge that we'll face. It'll be a challenge based on just the total number of people we have, the number of vaccines we're getting, and how to schedule it out. Now, we are getting better at all of it. We hope in this partnership soon we'll be able to schedule several weeks out instead of just a week out, because I hear people say, I just want to know when it's coming, and not have to get on every morning to sign up. So we are working on that. 1B, I think when we give our update on Monday, you'll see we've made substantial progress in. Even just the last 3 days, I think we've had 20 or 30,000 plus individuals over 70 get that shot of hope, even though we're still doing 1A and other people in 1B at the same time. Yes? We are hoping to have that data this coming Monday, along with age demographic data as well. It will start being statewide. We will work to see if we can regionalize it over time, but having to come in and pull that data out, we're working on it for Monday. We are committed to an equitable distribution of this vaccine. We have seen in some other areas that's not being met. We will be transparent with the numbers when we receive them, and if they're not where they should be, we will put extra effort in. We will be intentional to make sure we do it right. So in these sites, many of them will be with Kroger, bringing in. They have, and first of all, let me thank them so much. They are hiring individuals too, to ensure that they have the workforce that is necessary. That means they're going out and spending their own corporate dollars to protect Kentuckians, and we all really appreciate that. Along with, I know they have a lot of staff from their little clinics and others. In other areas, we have hospitals and sometimes local health departments that have man and woman power available. What they're finding is it's the IT and customer service side that ends up being the most challenging. Can your website handle 300,000 people trying to come on at the same time? If you have a phone number, do you have enough people there or an automated system that can handle the calls coming in? That's what we're finding is the primary challenge. We can set up an operation, as you see here, that's really efficient to get people through, vaccinated, monitored for the 15 minutes that they need to, and out the door. It's the getting the supply, getting it where it needs to go, signing people up, giving them the security that it's coming. Those are the challenges we face, but we're getting better. So the question is there a time when we would see everybody's primary care physician and maybe every pharmacy across Kentucky and the nation having vaccines? It would take a massive increase in supply. And if we had it, then yes, but we would need to have a vaccine for every single Kentuckian available to us at a time to do that. Because if we take the limited supply we have now and we put it out into too many different providers, that creates confusion because people don't know where to go and what number to call. So right now we have about 1,500 different providers that want to give the vaccine. They really want to do it for the right reasons. But if we were to supply them all, everybody would get 36 doses. And could you imagine somebody fighting to be one of those 36 calling 1,500 numbers? So the logistics challenge right now, and until we have massive supply, is best met through regional centers, but then more targeted operations. We've got homebound seniors. We've got communities that have transportation issues. We'll be using local health departments, pharmacies, and others to get to those individuals. So we got to think big. That's what we're doing here today. And we got to think more surgically, maybe small, and that's the other part of the program. Yeah. Wisely. We're looking at all the options. You know, one great thing about this partnership is that Kroger is willing to put its dollars out there to help us. But we're going to have communication. It's going to cost more, especially to reach the harder to reach populations. We're going to continue to develop our technology that can direct people to the right places. We're going to have to build up some of that customer service. If we run into supply issues with other parts, the needles, the rest, obviously we'll be able to use it there. I've been very pleased with the dollars that have come in, and a lot of them are going to be spent on the back end, meaning when we start getting past the great demand there is now and start reaching some of the hesitancy, that's when it's going to be a little bit harder and a little more costly to get there. I believe on the vaccine administration side right now, we're seeing significant dollars flow in, both in the second CARES Act and from FEMA. Right now, I feel good about what we have there. Now, we haven't seen all the challenges. Are we going to need an extra booster for any of these other variants? That could add to it. It's other things that I think the federal government's working on that we need, whether that is state and local aid. Certainly our local governments need that, as well as more assistance for our families out there. Now, the legislature is going to come back and pass a budget. We have enough one-time dollars to do that $220 million relief package to small businesses, $20 million to nonprofits. That's the type of help I think our people need right now. Again, in the vaccine side, it really comes down to supply, supply, supply. That's the only major issue. All right, thank you all very much.